at the minutes from our last meeting and to have them approved. Does anybody see anything wrong with them? Oh, roll call. I don't think we do a roll call in here. Okay.
We call them introductions.
Oh,
Yeah.
okay. I think everybody knows everybody's tonight.
Our person online.
Oh, sorry. Thank you very
Our
much.
guests won't know.
Danielle, would you like to introduce yourself?
Sure. So I am a second-year medical student at Comp Northwest in Lebanon. And there's a group of students that I've been working with there. We've all been working on some projects directed at healthcare related issues in Sweet Home. So we're gonna present a little bit about that here in a few minutes when we get to that part.
Hey. Thank you very much and welcome. Welcome to join us, and we're excited to hear from you. So
thank you.
Okay, so because now we know you and you don't know who we are, we will introduce ourselves. I apologize for my misstep. I'm taking a lot of things for granted tonight. I'm Lisa Gorley. I'm on the City Council and the chair of this committee. I chair it with the mayor. So should we just go around, Ray?
Yeah. Nice to meet you, Danielle. I'm Ray Towery and I'm the city manager.
And you know who I am. I'm Larry Gordon and retired superintendent, member of this committee and several other things in the community. So it's nice to have had the opportunity to work with your team.
And I'm Bob Dalton, on the health committee, do the health fair, like Larry, various other committees in the community. So great to meet everyone here.
I'm Sean Morgan with the Community Services Officer of Sweet Home Police Department.
And Sean worked for the paper for a year, so he knows everybody in town.
I'm James Page. I'm a project coordinator on a rural health outreach grant for Samaritan.
Jim Gorley, former mayor. I don't know. So now I'm currently a city councilor.
School board member.
School board member. All right, so I meant school board member, not a city councilor.
Yeah.
Okay, thank you.
And Dick's on the line.
Oh, yes. Mr. Knowles?
Hi, Danielle. This is Dick Knowles. I'm also a member of the committee. I'm one of those retired guys. I'm another 70-year-old. Used to be a administrator at a couple of psychiatric facilities in Northern California. Just ended up in Sweet Home. Nice to meet you.
Yeah, nice to meet you all. Thank you for the introductions.
So we're going to go through the other items on the agenda really quickly so that we can give you the most time possible. But we need to get a real quick report from our health fair people.
How about move to approve the minutes of.
That would be awesome.
Okay.
I don't know. I'm off. I apologize. I didn't get home till 4 o'clock this morning.
Trying to catch up.
So
Motion to approve this July 20th, 2020 Community Health Committee minutes.
do we have a second?
A second.
We have a motion. Any discussion? All in favor?
Aye.
Any opposed? Motion passes. Thank you. And now I will start checking things off. So we'll go to the Bob and Dick.
No, I think just basically Dick and I are grieving because the date is come and gone for the health fair this year just due to COVID. But Dick, you might want to share just a little bit of, you said you had sent out some emails. You might just kind of want to touch on some of the comments a couple of sent us. Have I got you off guard?
Oh, no, I was just living through a bit of melancholia over the weekend, missing actually a lot of work, but after the fact, kind of a lot of feel good after doing a couple of years worth of this, and got some very nice responses from folks in the community, clinic. I sent out to county organizations, that sort of stuff. And it turns out that people actually do remember coming to Sweet Home. A number of them also garnered some folks that have used their services. And quite frankly, most of them are finding a way to provide services in Sweet Home itself. So they're all looking forward to doing next year. Bob and I have talked about doing something in between. That would be nice, but it was rather gratifying because, I mean, I just did it on a whim because I was kicking myself around the block. So that would be it.
Which makes me think really quickly. I just had the opportunity, the Yale Center of Emotional Intelligence was started by a gentleman named Mark Brackett, and they just had a 2-day webinar that could be viewed at any time. And it was only $29, including the book, and it covered emotions at work, parenting, implicit biases, cultivating emotional intelligence. And I don't know, do you want me to forward that kind of thing to you so that you guys can have access to that? Okay, all right, I will next time.
That would be good.
And I would like that.
Okay, all right. And so that brings us to Western University.
Well, I'm not sure when you're wanting to actually do Danelle and her team, if you're wanting to do that now, or do you want me to just give a brief report on where I am and then let them, how do you want to deal with it?
I'm gonna let you, you're totally in charge of that.
Okay.
Go ahead and give your.
Danielle, I'm not for sure. Well, I see others on there now. Welcome.
Yeah, I think Marina just got logged on.
Marina, you want to introduce yourself real quick, like?
Hi, I'm Marina. I'm just starting my second year at WesternU right now and excited to be here and talk to you guys.
Okay, well, I will talk real quick like about what I've done, and then I'll turn it over to you ladies to present your program. Di Lacey, Kristen Adams, and myself met last week to talk about a program called MIKE, M-I-K-E. It is a program that some of the student doctors will potentially be working with individual students at the high school in a mentoring type program. But it's a program that a friend of Di Lacey's actually developed. Normally there's a charge. I'm not for sure what that charge is. It's like $1,000 per student. And Di Lacey has talked this lady into actually waiving any kind of fees that would go with the program because she feels it's very important to bring it to Sweet Home. It would be a program for 9th grade students. It would be on a voluntary basis. The kids would actually sign up. Tentatively, we're looking at running it as a club. And since there is no COVID has kind of changed things as far as having real meetings. They would be virtual meetings, and the students would, from the university, would be doing kind of what we're doing tonight, probably with Zoom or some other program. And they would end up doing experiments with the kids, different careers that they would be exploring with the kids, and basically giving these 9th grade students the opportunity to get to know some of the college students and, where they come from? What do they do? How do they get there? What are some of the obstacles? Is it something that our kids might find interesting and want to do themselves? So it sounds like a real exciting program. Kristen Adams was taking it back to her principal, Ralph Brown, I believe. And Ralph, I have not heard back yet as to his feedback, but my guess is that it would be a very exciting program for our kids. They decided 9th graders was a good place to start because so many kids drop out right at 9th grade level. Either physically drop out or they drop out from school and just don't really want to participate. It wouldn't necessarily be for the brightest kids. It would be for any kids that might be interested. So a student could have a D average and still participate if they're interested. And so it sounded pretty exciting. It sounds like a way of motivating some of our students and potentially giving them the opportunity to find out if they really might be interested in joining a medical type career. So I don't know if ladies, have you talked with Di about that program at all?
Yeah, we actually just had a meeting a day or two ago with Di and Dr. Neal, who is the one that sort of developed this program.
Oh, great.
And learned some more details about that. So we were going to talk about it actually a little bit more in our presentation, kind of worked it into our
Oh, that'd be perfect.
PowerPoint. Yeah.
So in that case, then I'm done. That's my report, and I'm going to let the ladies have at it because I'm sure they have a lot more to offer than I do.
Before you're off that, Larry,
Yes.
is there any financial help that you think you're going to need?
There was a discussion about materials. You know, the experiments that I heard I talk about revolve 2-liter bottles and, you know, things that normally you can collect. But there might be a small, what do you think, girls? A small amount of materials that might need to be purchased?
Yeah. We haven't seen, that's kind of one of the limitations at the moment, is we haven't seen the actual curriculum itself, but similar to what you'd heard. It sounds like they're pretty basic supplies that they would be using, like, I don't know, staples, paper clips, rubber bands, bottles, stuff like that. But depending on the limitations of the students, you know, if they don't have some of those supplies available to them at home, may need some simple supplies, yeah.
So cost, I would predict not more than $100 to $200.
Well, it sounds to me like the school district probably will have the needs that you
I would think,
would have.
and if not, we're pretty creative. You know, Rotary would be willing to probably help, and other community organizations. So I think
was just
we can
thinking
handle
that
something
same
like
thing.
that. Yeah, good. Okay. It's all yours, ladies, for at least if that's all right with you.
Oh, that's wonderful.
Okay.
All right.
All right, let me just share my screen. How does that look? Okay, good. Well, this is our first page. We just want to kind of give a rundown of the history and background of this project and kind of what's happening now and kind of future goals as well, moving forward. So back in 2018, a couple of students who are now in their 4th year started this project, and they had a qualitative and quantitative team. The quantitative team was just kind of gathering information and kind of getting a background of what was needed. And then the qualitative team just directly interviewed people in focus groups, just to see what the population of Sweet Home needed. And then they compared the data and looked for the solutions. So we have really been working on goals on the kind of like the qualitative team end. When they did the focus group, there was 5 of them, and they had a stratified population. And by using open-ended questions, they kind of looked for common themes. And as I said before, this was started in 2018. So we would hopefully conduct a focus group in this fall to kind of get an update of what the community wants and if they feel like it's been had these needs met. And possibly also assessing the change needs since COVID hit. So the 2 questions they posed in 2018 was, what do you think prevents Sweet Home residents from accessing healthcare, and what do you think is the biggest health concern for Sweet Home residents? They also asked a couple of supplemental questions. What local health resources are you aware of? Do you think Sweet Home residents use those resources, as well as what do they use them for? And then just they also assessed what other resources would benefit the community. Danielle, do you want to start?
Yeah. So as you can see, this was really focused on identifying the available resources and also unmet needs. So this just shows, and you're probably all well aware of these resources that are available in the Sweet Home community. The family practices, and I'll elaborate on this in just a second, but some of the limitations that were found, even though there are 2 clinics, are the hours that are available for people to come and see a doctor. So a lot of people would like to have access to care either after work or on the weekend, and that's not available really right now. Then also you see under the other tab, fire department, and it came up during those focus groups that the fire department is often utilized as sort of like an urgent care type of service, that people end up going there and then needing care, either getting transportation or kind of triage there at the fire department, because there's not that sort of mid-level urgent care type of service available really in Sweet Home. Okay. So these were the main concerns that were identified. So going back to the primary care issue, you guys have probably heard some of this too, being engaged in all this healthcare stuff. Some of the difficulties of getting established and retaining practitioners really in any rural area, and this is true also for Sweet Home. So high turnover rate, of course, it's harder and harder these days to get established as a private practitioner without being part of some bigger health system. So getting those primary care doctors and keeping them in Sweet Home. The after hours care, like I mentioned, especially evening and weekend access, is a big issue, and that's kind of what is sending people to the fire station. Transportation, as far as I know, I believe that Lynn Benton bus is based on a grant program, so that's available, but again has the hour limitations because it's just available on weekdays. The fact that the population is aging just changes the type of services that are needed in the community. With the average age going up, of course, that means there are going to be more people with chronic conditions needing more consistent follow-up type of care, and a lot of people commuting out of the commuting to their jobs outside of Sweet Home. The mentorship, that is kind of where we were going to plug our mentorship ideas, and the MIC program is providing some of that professional friendship and mentorship to the youth in the community, so that they have kind of some role models and people that they can ask questions of. Homelessness being another issue, especially also affecting the student population, with 10% being without permanent housing. Mental health care was another major theme that came up, lack of access to treatment. And then, of course, the nutrition and education. So another thing we see in the school, 71% of the students being on the free and reduced lunches. And as I'm sure you're well aware, the Boys and Girls Club provide a lot of resources to the youth to fill some of those needs. So based on all of that background data, there were really three main goals that were identified out of that qualitative study that was performed. So the first one was pooling community resources and figuring out how to find a nice, concise resource that can be provided in the community so people know where to go if they're needing assistance, the youth mentorship and community education, and then the improved access to healthcare. So we'll elaborate on each of these a little bit more. So first one is the community resources. So the idea here was to, again, just kind of compile all the available resources in the Sweet Home community and have some sort of nice either pamphlet or card that could be provided to people. Again, so this is just so people know what's out there and how to access those resources that are already available, because there have been some issues with underutilization of some of the resources that are available. This is probably the one that is closest to being finalized actually right now. So as you can see here, CHIP has been helping to finalize the resource list. I've got a couple of slides that have everything that's been compiled so far. We would love to hear feedback on the exact format of how to distribute this. So a couple ideas would be like a pamphlet, as it says here. We've also talked about having some sort of just card that could be handed to people. It's a little bit easier to kind of stick in your wallet, maybe with the top utilized or most helpful resources. Could be something actually that's distributed at the fire department, since that's a common access point. But any feedback you guys have or ideas on how to format this list would be very helpful. So next couple slides you can kind of just glance at. This is sort of an idea of how we might format that and some of the resources that we have listed so far. All right.
All right. right. Unless someone has any input about the resource pamphlet, I will move on to the second goal. So the second goal was the youth mentorship and kind of community education classes. So in the past,
Danielle, if I might, Bob Dalton and I have done a lot of work with this. You were mentioning aiming towards the fire department. Our aim had been towards the police department, mostly because their interaction happens at 2 o'clock on Friday mornings as they're strolling around the beach and trying to help folks figure out what they're going to do for the rest of the day.
Sure.
Actually have something, Sean, who's in the room, may have a better sense of what the police chief came up with kind of a format, and then this COVID thing happened, and it's kind of put things in a different perspective. And we also have a number of other options that are available that we did not have when we started this, actually. Much of it coming out of outreach programs. Benton County and Lynn County have gotten together and done some really very creative things. So there's goal slides and all that, but maybe try to get some contact going between Bob and or myself, and we can fill you in better.
That would be wonderful. Yes, I think you had mentioned to us at some point that there would probably be some updated resources in light of COVID. And I don't think that those slides reflected that. So yeah, definitely something to add. And I think that's a great idea to pass it out at the police department as well. Maybe just making it available to all the first responders in general, because they could potentially be a resource or a way to get that put out in the community.
If you're looking at numbers, Bob and I had developed a business card to hand out regarding a Samaritan medical bus that's been coming through, and the similar thing could be done there. You hand out information to folks who are coming to the free meal sites, and those would be people you'd have ready access to.
I think I think you got two different things you're talking about here too.
Announce yourself, please.
This is Jim Gorley. You have one is a resource pamphlet that has all the resources and maybe a little more detail on what they have and do, and then you have a card that you hand out that has basic stuff on it.
Yeah, we kind of backed away from the resource pamphlet in the future, mostly because the police department was so concerned about trying to help folks right away. And I'm not speaking for Bob, but I think we agree with that. The fact that you tell people in Sweet Home that, yeah, you can get help in Benton County in Corvallis probably is not that helpful. But to actually aim them towards things that are locally, you probably get that on a small card. But yes, to just
go ahead.
But I think what I was saying is that there's two different things here. You're talking about one that might be in somebody's desk that they would use when they're talking to somebody, and the other one they hand out.
Yeah.
I think this is very speaking, and I think both have a place. If I was a teacher in the school district, it'd be nice to have one of those pamphlets to be able to hand to a parent that wasn't in an emergency crisis at the time, but that they just might want some information. On the other hand, if I'm a police officer coming up to somebody that's having an emergency in front of me and I want to help them, they don't want to read a pamphlet. So I see the value in having both. So I don't know how much time and energy and resources everybody has to put into this, but I don't know. Sean, what do you think? You're the community liaison now between the police department.
I think you're right on target there. Targeted makes a lot of sense, having targeted things. There's been a rate, but I'm going to talk to the officers about how they might not do that sort of thing when they're interacting. That makes a lot of sense, having tiered levels of good, they're targeted to specific situations and more generic.
Does that help you ladies at all?
Yeah, absolutely. I think that's a great point. There's no reason why you couldn't have kind of two different forms. The most high impact, I guess, or immediately accessible resources in sort of like a card format, and then maybe a more extensive pamphlet, like you said, for people who are in a crisis. I think that's a great idea. And I don't think it would be too labor intensive to make those two different formats. I mean, we've already got them all written out, so it'd just be a matter of putting it onto a card versus a pamphlet. Should be pretty simple.
So I guess this is Larry again. My question would be, if you're going to develop a pamphlet, is that something that you're going to develop and publish, or develop and give to us to get published? Or how do you ladies foresee the actual process of making this happen? I mean, you've got good information there. How do we put these things together to make them so that we can hand them out?
That's a great question. And Marina, feel free to jump in too if you have any thoughts. But one thing I did want to bring up is I'm not sure how much work you guys do with the Community Services Consortium and Scott McKee, but we worked with him a little bit during the point in time count. And I know they actually already had a compiled, obviously this is not targeted at Sweet Home only, it's for Lynn County, but they already had like a booklet that they provide to people whenever they're interacting with them. So I thought, just sort of modeling it after what they have, but just condensing it down to Sweet Home only resources would be pretty simple. And I don't see why that would be something that we couldn't put together the resource and provide to you guys for approval before you print it.
Have you seen the CSC booklet? It's extraordinarily large.
Yeah,
And that was
very
actually that was our starting point. And actually there's a fair number of them floating around town already.
Okay.
And so the whole point was to try to get whatever it is, 140 pages down to 2 or 3. And that's where you guys, well, your predecessors came in. That was difficult.
Yeah, theirs is truly a book. So it would be more basically the things we have listed here in the slides, putting that more into a pamphlet that's targeted at Sweet Home, not the entirety of Lynn County, because I think that's what their booklet is more so.
Yeah, the CSC booklet is the kind that Dr. Horton's talking about. Could and use it as you would. They hand them out, they're free, and actually they're online. So.
Yeah.
Correct me if I'm wrong, but I thought that Chip might be helping with printing and producing the actual pamphlets. I'm not sure where predecessors left off on. We're not really we weren't totally looped in with how the physical copies would be distributed or like created.
You're gonna draw a blank from me.
Okay, that's good to look. That's something I'll look into then.
Yeah, I think that's more from your end. I don't know. I'm smiling because chip is a phrase that they use for 4 or 5 different things that are going on in the community all at the same time. Well, that's another conversation. It'll make you laugh. So that's the first time I've seen that used in this context. It's not inappropriate. It's just I don't. Bob, correct me if I'm wrong, but I don't think I've seen that before.
No, I haven't.
I think
But-
I don't know the acronym off the top of my head, but a couple slides back, I think it said what it stands for. But
well, it's community health, and you have partnership. And they have community health programs. They have children's health initiative. It's like it goes on and on.
So is this something that you would
It's a
need?
nice.
This is Lisa Gorley. Would you need a couple copies of this and find out if they have a program, obviously, on online so that you could adapt it and utilize it, make it the way you need it to be, or to see what's different about this particular booklet that they've already got going? Maybe it needs to be more accessible or streamed down to what the needs are. What does that look like to make that a reality?
if I might, what you're looking at, page 1 of the most current resource list, that's actually coming from that book.
Okay.
With the help of with the two previous, we went through and whittled it down as best we could. That was when Bob and I and they decided that there were at least a half a dozen other names that needed to go in there. But many of those people aren't providing services right now. Nobody's doing face-to-face, so it's a little troublesome, and you really don't want to put it out there on the street as if somebody can use it. So I think this is a good time to develop it, but not get it into the street. We've got some time here that some of the pressure is off. But yeah, I've got the original. I've got it divided by a quarter, and it's still pretty chunky. That's when the police chief threw up his hands and said, "I'll just put something in the cars."
Yeah.
Yeah.
So I think
Yep.
this resource is pretty much done being developed, barring adding any new resources that are COVID specific. But I agree, it probably wouldn't be appropriate to necessarily put out in the community yet, since it's not. We don't know what's really available on this because of COVID. So a question for you all, as far as what we can provide, we can definitely get this updated and ready to go for when it is appropriate to actually print it off in pamphlet form and distribute it. Would it be helpful if we picked, the few most helpful resources for an emergency-based thing that could be printed on cards and used right now? Because I don't think that would be hard to do if we sort of developed a template that has those resources and you all could print them off and distribute them through the police department.
Danielle, this is Ray. Can I interrupt you for just one moment?
Yeah, absolutely.
Sean, the chief and I had talked about him doing this.
So we have a list that available, the officers have.
Right.
Specific to a number of areas. Working a large version.
Okay, so Danielle, can we put you in touch with Sean? Because we may not have already tackled that quick handout. And I hate for you to, as a medical school student, you're already busy enough, so I hate to have you waste your time.
So
yeah.
So if I might, Don, one of the things that we added was, rather than add individual more and more names, at the end, put a phone number or some contact you could give as an example, and then if you need more service or whatever, call this number. And we were trying to come up with who to call.
Because that's my concern too, is by the time you get this out there, COVID's continuing, some of these entities may go away and be replaced by others. And with the level of predicted homelessness and unemployment, Lord help us, that doesn't happen, but in case it does, we're going to be looking at a very different world in 6 months. And so I really don't want to do unnecessary work, but be out in front of it the best we can at the same time.
I'll just email you something, Danielle, what I've gotten, and then you guys can go from there.
That sounds great.
One of the needs that I noticed on there was the substance use disorder assistance and all of that. And so we're offering that. Samaritan is through the federal grant that I'm on in the Sweet Home Family Medicine Clinic. So if we could incorporate that into the list, either one or both, that would be ideal as well. Because I don't see it on there. It is temporary, maybe for the next 18 months or so, but it would be good to get that piece in there, especially right now with what I anticipate being a really dark time in terms of substance use disorder stuff and overdose. And
yeah, that wasn't even in existence when we started this, so that's why I say.
Which is why I just wanted to chime in and say, hey, we're here to. Yeah.
And that's why we came up with having a number at the bottom. Contact this number. There may be a different. Well, you wouldn't say maybe, but for additional services, calls so-and-so. You know, call Ray's house or something like that.
Your number, it's your number, Ray, we got listed.
But it sounds to me like we could probably move on to the next one. If you ladies are gonna contact Sean, that would take care of that portion really, and I'd make it really very strong and usable.
Do you have Sean's contact info?
No.
I don't think we do.
If I could get an email from one of you ladies as well, I could talk more about what we're doing over there and kind of the breadth of the services that we have right now.
That'd be great. Our emails are at the end of the slides. And we can also send out this PowerPoint slide too.
That would be perfect.
Yeah, please.
Thank you. That would be good.
Great. Okay. Moving on to the second goal. So in the past, WesternU has set up educational booths at the Sweet Home Health Fair, which is kind of focused on disease prevention and basic health information, which was, as you all know, probably canceled due to the COVID pandemic. And students, not us, because the COVID pandemic never actually let us come to the school, but they used to do it in class presentations at the high school. I think they helped out in anatomy education. And then currently we're trying to start something with the Mike organization. In general, just kind of interested in getting mentorship between medical students and the students in the high school, and just kind of also making it COVID friendly. So it would be like remote mentorships. So we don't have to wait until after schools are open to visitors and functioning as normal before. The program does focus on introducing students to kind of the medical fields, as well as educating them on health and well-being. But personally, we're all really interested in just starting the mentorship program, Mike organization or no Mike organization, because I think that students would probably really enjoy meeting people that aren't that much older than them, that are in a higher education, and just kind of learning from them. I think it's been really hard on everyone being at home and learning, kind of not very engaged. So we're kind of open to hearing what you guys think about this Mike program. We'll distribute these slides so you guys can take a look at it. But we're just really interested in doing this remote mentoring. So we were also kind of talking today and brainstorming that we could find contacts in the community and seeing if other students from other schools would also be interested in engaging this mentorship program, just so students at the Sweet Home Health High can kind of be exposed to people in different fields and kind of seeing the diversity available for them to get involved with in the future. So if anyone has any input on this, we'd really appreciate it, because we kind of want to make the mentorship not something that we think the community needs, but what the community actually wants. Any comments? Okay. Moving on.
Well, I before we leave this, Larry, important.
Yeah.
Charter school may be another school that we would want to at least talk to in regards to the program. I'm not even sure if they're, I don't know that much about the charter school now.
They don't go up to 9th grade, but
They stop at 8th, I believe.
yeah.
But it might be worth at least talking to the charter school and letting them know what we're doing, and they may have some high school type kids that are homeschooling that might be interested.
Well, and Diana Gerson, retired principal, is our YAC leader now. And I think that would be a good thing for them to help organize and work with, at least stay plugged into. Leadership kids. I honestly think at Sweet Home we have, we can support family culture and how that limits access for many of our students who don't get good grades and who don't try because they don't envision themselves doing that, and they don't know what that looks like. They literally just don't know how to push forward. And I think that taking down those walls should happen in junior high and 9th grade to start with, and even pushing down lower as we move forward. But I do believe there's some avenues there to reach in and to reach the kids. But I think it's more than you're going to find in one location. You're going to have to look in several to get those kids to envision themselves even plugging in with you. So, because they think only smart kids go to college and only kids from affluent families go to college. They don't see themselves doing that, and neither do their parents. So.
Yeah, I was actually really excited about the mentorship part. We've kind of had some conversations about this as we've all been brainstorming how to do this. I went to Jefferson High School, grew up locally, and like nobody in my family is in healthcare at all or anything like that. So I think a lot of these kids probably have additional barriers that I never faced, but just knowing how important it is really to get in contact with people that are going into some of those fields. If you even have an interest and you don't have somebody in your family that's doing that, I definitely know how important that is and how it's really hard when you have to just go out and make your own contacts, you know, like bug your own family doctor. Can I come shadow you?
Yeah.
And it's hard to take that initiative if you don't have somebody kind of guiding you. So something we've kind of talked about is, again, this is kind of looking like two different things. The MIC program sounds like a really cool opportunity. The thing about that is we've kind of mentioned that there is expense associated with it. Right now, they're doing this cool thing where they're offering it as a pilot, which is great. But long term, I don't know what that will look like, if that's going to require grants in the future to keep it going. But I know I would, and Marina and our other classmate, Shay, we're like really hoping to get some sort of just maybe less formal mentorship structure going on too, where we can just connect with some of the kids and put them in contact, as Marina said, also having other local health profession students. So we're in med school, but I have, you know, local friends who are going to dental hygiene school or nursing school or any of these potential professions, and just letting them get to know some people that have done this and building the network, the social network, because really this stuff, you know, it's about brains and all that, but it's also really a lot about who you get to know and having a good social network. And that's part of mentoring and developing that. So we really just want to be able to provide that to the kids.
When we were building the student leadership summits, we found the Boys and Girls Club a great resource, and also the library, because we have kids that plug into those. And so whatever kind of advertising or draw that you create, they're good resources.
Okay, that is great to know.
Ladies, when Di and I talked with Kristen, the number of kids sounded like 3 to 5 for each of you. Is that what you're looking at, or how many students are you hoping to work with?
It sounded like for the pilot program, they put the number at about 20 for starting this, because there are 3 of us, and we might start trying to recruit some of our first year students, just because we will be having to hand off at some point.
Right.
So yeah, it would probably be about 4-ish through the MIC program. Again, just for general mentorship though, or if there are kids, you know, letting us be contacts if there are kids that want to ask questions of somebody who's gone to college or done all that. I mean, I know I personally would be happy to talk to any of them that wanted to reach out, but formally through the MIC program, yes, about 4 to 5, I think, is the ideal.
So have you thought about developing a pass along card or a link or something so they can access you if it goes by word of mouth to a parent or just a friend?
We hadn't, but I think that's a great idea. Yeah, that's kind of something we didn't really know how to go about, is getting something like that started. That's just letting us be an open resource if they want to pass that along to interested students.
I found when I was working with the YAC, developing even a PowerPoint was very beneficial to explain what we're doing. And that really helps if you're going to the Rotary or you're going to the high school, or, you know, something that can just be sent out, you know.
Okay. Yeah, we could definitely put something like that together.
It's easy enough, so.
Well, especially if you're gonna pass it on to the Boys and Girls Club, library, if they could have something that they could show with real faces of all of you.
Yeah,
That would be something that I think would probably excite the kids more.
Put it on our websites. So.
cool. Yeah, well, we'll talk about that a little bit more and do that. I mean, I think it's kind of more of like a little pet project that I've got going on that I really want to get something like this started. Definitely, we're going to keep, like working on Mike. But I don't know. I just feel like in some of these little communities, it's nice to just build up that kind of informal, just getting to know people. And like you said, seeing the faces of people that are doing this.
I like the informal. I think the kids would respond to that a lot.
Mm-hmm.
I think it would also work really well for these times when you got to stay engaged, and I think everyone would like to network and practice networking and like learning how to make connections and stuff. That's definitely a skill we all have to work on, and that'd be a great time to develop it in high school.
And it's good to get them where they live with their neighbors, and then for them to be able to investigate a little bit by clicking onto a link without any kind of commitment in their behalf, but at the same time, their ability to reach out. Because like I said, these kids, they don't know what it looks like. And there's enough walls at home and in their community, their friends and stuff. And that mentoring is going to change lives. So thank you.
Absolutely.
Yeah, just building off of that, do most of the kids have access to the internet in Sweet Home? Would that be a barrier?
I think statewide, you've got a third of the students who don't. It doesn't matter if you're in Sweet Home or Beaverton, but we're trying. We're trying.
I think all of them can get there if they want to.
Mm-hmm.
They go to the library. There are, tremendous resources in the community, but they have to hear about it first and then go find a way to connect.
And there's
Looking at making some hot spots.
Yep.
Yeah, because in some communities are literally sitting in the car in the parking lot to be able to do their homework, and so that's the reality, and I think that's going to increase. So
yeah,
we're trying.
Come.
All right, moving on to the third goal. Danielle, do you want to present that?
Sure. So this was addressing the issues with access to healthcare. So a big development in this was the Samaritan mobile van. So as you all know, this has been coming every other Tuesday to Sweet Home, runs from 2 to 6. So that helps expand some of the access for after hours care a little bit. 6 p.m. is still kind of a cutoff for work times for some people, but I think this has particularly been helpful for some of the homeless population in Sweet Home because unless it's changed, last I checked, it was usually parking outside of the Man of Meals and kind of coordinating with that. So helping to fill some of those needs. Something that we had been trying to work on sort of at the end of last year before COVID hit and kind of put a damper on this is we were talking to one of our preceptors and instructors, Dr. Richardson, because he is contracted with Samaritan or licensed with them, but he also is able to oversee us as WesternU students since he's faculty, and he was open to actually adding some additional hours at the van if Samaritan would be open to that and bringing some of the students along. Something we had talked about is maybe bringing it on Saturdays so that people could get the weekend access. Unfortunately, on our end, our school, we can't even go on campus right now. So I know there's no way our school is going to approve us to do this until we're able to be back in person for classes. So unfortunately, that's going to be several months out for us to do anything like that. I know the van is still going to Sweet Home, so for now it's still expanding access that way. And I believe, I actually haven't looked this up in a little bit, but last I heard they were also going to start, I think once a month on Fridays, a mental health practitioner was going to start coming to Sweet Home with the van as well. So this was kind of the big target. Yeah, go
If
ahead.
I might, Danielle, they are not coming anymore, well,
Okay.
anymore. It's been put on hold, but the entire system's been put on hold because the bus is broken.
Oh, okay.
They're having to do some inboard stuff. They have a generator that's not working, so they're thinking anywhere from 6 to 12 weeks it'll be out of service. The mental health bus is also, you're correct. They were coming once a month, the last Friday of the month. They actually had a psychiatrist, not just whatever. It was a psychiatrist and then the nurse on board also. But again, he was tied into the bus. So until they have the bus fixed, it's not gonna happen. And if I might, and please don't quote me or have me sign anything, but it would be very helpful if you, as the med students, can put a little, and maybe even Dr. Richardson, now that I'm looking at a name, could put a little pressure on Samaritan to give us a little break on time, because, well, just for example, they just started just before COVID, or sorry, just before the bus broke. They went to the 2 shelters in Albany, and they got something like 14 folks to show up in one day. We were struggling with 1, 2, I think we had 4 the very first time. So at some point, Samaritan's going to look at, well, let's see, let's count and all that. And I could, just being selfish, I could sure use some help from the med students to say, you know, it's not fair. It's a small town.
Mm-hmm.
They have different needs. Please don't stop coming. So
Do you think part,
that's my
Dick, do you think part of the problem with usage is possibly signage, that people forget that it's there? Maybe we need to, when they come, put out some sandwich boards or something that reminds people that it's there, or we need to move it out to Main Street.
If I might, selfishly, Bob Dalton came up with the instant solution, which as soon as he came up with the solution, the COVID thing happened. But it does go to the Manna site. It's at the United Methodist Church. And bags of food, because they used to go in and get served. Now bags are served. You just put a business card in there that lists all that information. You put a card in each of the sacks of the meal sacks to wherever they go back to. Similarly, I've passed out business cards to the outreach folks, the aforementioned Scotty McKee and folks that he works with, and they also are passing them out. So in order to see, sandwich boards and all that, you actually have to be there. And the important thing is that people have it where they live, end quote, where they stay, where they hang out. So the business cards were a fabulous idea. Now we're going to have to write them because the whole thing's changing. And if you add Saturday, and good for you guys, we can always do that. Samaritan seems to be willing to pay for those kinds of things. We don't have to chip in too much. We just have to let them know. So, but yeah.
Dick, we also have that community signboard. I know the Boys and Girls Club put a lot of stuff on it. Right now it says, shop locally. I think a lot of people read that as they come into town, and maybe there's a way, I don't know who's in charge of that. The city, but maybe there's a way of getting, on the night that they're coming, a day or two before, they remember, the sign, the van is coming.
Boy, I totally agree. We had trouble getting information on that board. When it comes about, maybe we'll, it doesn't have to be me, but at some point that would be a good idea. Because this isn't just for the homeless. People have kind of lost that. It's for, and come time for vaccination, the kids at the schools. This is a perfect way for them to to not have to line up at a clinic or do whatever.
Well, it catches my eye every time I drive into town, every
Yep.
time.
Yeah,
So to me, that's a great way to advertise it.
you're supposed to be paying attention driving, Larry.
Oh, well, the chief isn't here, so I can say whatever I want. Well, John, you can't pass that on to the chief.
Sorry,
Who is he anyway?
Yeah, speaking of the vaccines, I know actually in Albany, they sometimes park outside of schools and do that. So yeah, there's lots of cool opportunities with this. I really do hope that the Saturday thing can happen sometime in the future. It's probably going to be after our group hands off to the next class,
Right.
just because of COVID. But our hope in that too was that would kind of get more of the, target a wider group of people in doing that, just because there are a lot of people, I think, that from the focus groups, it sounded like, who do work and just can't get to the doctor with the hours that are available. So hopefully a weekend
Right.
time could make it available to some of those folks.
I
That would be great.
agree.
And I definitely know there'll be a lot of enthusiasm from the medical students to get involved with this. We're all looking to get more involved with patients hands-on,
Yes.
or face-to-face.
We'd love to have you anytime.
Yep.
Do you want to go
Okay.
over this one?
Yeah, so this is kind of the most recent project we kind of came up with this summer, was partnering with a sweet home clinic. Currently, Dr. Asuncion provided us a list of chronic care patients with like chronic diseases that haven't been in to see her in the past 6 months. And she's kind of provided us their numbers, and the goal is just to raise awareness of the ability to have telemedicine visits during this time of the pandemic, and also just kind of connect with them and touch base and see how they're doing, and to kind of let them know that the clinic's thinking of them and that they should get back into touch. And in the future, our goal is to do a research survey where students would call patients that recently had telemedicine visits and just assess how satisfied they are with it and what could be done to improve their experience. With the current pandemic, it seems like medicine will really be moving towards telemedicine services, and I think that would be a great way to improve the accessibility. A lot of people in Sweet Home, as Dr. Asuncion told us, don't have the ability or the means sometimes to come to the doctor regularly. So we're hoping by increasing awareness for phone call visits, people will be seen more regularly.
That's a great idea.
Yeah, we're excited for it. And then finally, and that is it. Actually, we also have future focus groups. We're hoping to do focus groups again. We were planning to do it in August, but everything's kind of slowed down and our school pushed out being remote longer. So we were going to do the focus groups in the future rather in person. We're going to do them over phone or over Zoom appointments. And we were just kind of wondering if you guys think it's better to wait until after COVID to conduct the focus groups again, or to do it during the pandemic, and if anyone can identify any areas that are kind of new that would augment our goals and kind of areas of concern for this project.
I think if you do, this is Jim Gorley again. I think if you do it during COVID, you're going to get different things talked about than if you did under normal circumstances in Sweet Home, because they'll be more concerned over the things that have been happening specifically due to COVID, which is fine, but you're going to have different focuses than if you were to be here after when COVID wasn't here. So if you want to have more focus on it, then you do it now. If you want to do it, have focus on the other issues, you would do it later. So
this is Dick. I totally agree with you, Jim. It would be a nice comparison. You've got the first one against the second one. You could have an asterisk of that one was done. I actually don't have a preference, but comparisons are kind of fun. Especially for you guys, I would think.
I think it's just sorry, this is Lisa Gorley, what's doable for you guys.
Yeah.
We
Yeah.
don't know what's going to be happening in March or June, but whatever you find feasible.
And this
You'll
is
be
Larry.
here.
This is Larry, girls. I think your plates are overflowing right now, to be honest with you.
I agree.
You have, I mean, with the goals that you're working on and the projects you're working on, and I know your college, your studies have to be overwhelming, and you're entering your second year, which, as I know you know, is going to be a lot tougher. I think you should just work with what you're doing. If you want to share this slide presentation with the people that were part of the first group, and then ask, at the end, if you have any comments or questions or concerns, please send them to you. That way you could get input from those that already know what's going on. To bring in a whole nother group of people, I'm worried that, I don't know when you do the handoff to the other first year students, but I think you're going to be overwhelming everybody.
That's what I'm thinking.
Yeah.
So,
Well, if you can focus on what is doable, though, you can focus on following through with the cards and observing and participating in that. And then some kind of a mentoring plan, what that looks like, which is huge obstacles right now. There are insurmountable obstacles, and yet the need is greater than ever.
Yeah.
Mm-hmm.
And it's exploded in front of us, and just tackling that alone is a big part while you're going to school and dealing with your own stuff. So, and the rest is, at some point, it'd be nice to do a presentation for the city council. At some point,
Well, I really think that you should have, rather than them do 3 or 4 presentations at different times, maybe we'd have a school board, city council special meeting that they could present it to all of us at one time. Because we're all, the city council and the school district, school board are both interested in these programs, or they should be.
okay.
And so the 2 groups, there's no reason you couldn't do one presentation for both of them, especially if you're doing a Zoom call.
and anyone in the community is welcome to attend both of those
Exactly.
meetings.
Absolutely.
So anyone that wanted to could be there.
Yeah.
Might even be able to find a community partner that will help with the mic program.
Mm-hmm.
That'd be
Yeah.
awesome.
Do you have an idea as to when the handoff is going to take place?
The handoff, is that what you said?
Yes, for when you guys are going to be leaving and when the new first years might be coming on board.
I believe that typically happens sometime around the first of the year.
Okay.
Our handoff, unfortunately, this is another reason why some of this kind of was slow moving for us, got pushed back this last year too. It was like a slow handoff to us. So our
Right.
timeline has really been condensed down. But yeah, usually it's right around that time.
So we'll have new faces and new names around the first of the year.
Yeah, and we're planning on really kind of bringing some of the first years in a little bit sooner than that, sort of delegating some of these tasks. Like us as second years kind of moving more towards the grand scheme of things and administrating some of this, and starting to train them on how to take this over earlier so that they're ready to hit the ground running. So it's a little bit smoother of a transition than we had, hopefully.
I would make
Yeah.
myself available to meet with both groups anytime you feel that you would like someone from this committee to be there, if that's all right with everybody. I've been the liaison, so to speak, since it started, so I would be more than happy to meet with both groups and transition ladies.
Thank you. That would be wonderful. I think it'd be a great idea once we bring them on board to have kind of a group meeting and get everybody on the same page.
Good.
Yeah.
Just let me know.
We actually were kind of discussing starting the recruiting process soon and just opening up to all the first year. They just started school, so they're really excited to get involved with things and just seeing which individuals would be drawn to this and potentially like interviewing them to pick the best matches. Since we're not actually meeting them, last year we were seeing the second years and like talking to them about different projects, and it was much more personal. But right now we're all just doing things through Zoom, so Danielle and I and Shay can't really meet them. So if anyone has input for what we could put into the application for picking individuals that would really serve Sweet Home to the best capacity, we'd appreciate it.
Well, one of the things that they don't have to be from a rural town to want to live in a rural town.
Yeah.
And I think that's kind of an important question is, do you want to, are you interested in practicing medicine in a rural town? Because if that would, I don't know.
That's
What
a
do you
major
think?
factor.
It's a major factor.
Yeah.
And it doesn't just mean because they're from a rural community to grow up in. Some of the people from the cities may want to live in a rural community.
Absolutely.
I'm from the Seattle area, so this is the most rural I've ever lived.
Rural looks pretty good, doesn't it?
Yeah, it's nice. Okay, well, with that, we should be wrapping up. These are our contact information, and I can distribute these slides if there's like a mailing list or something. But yeah, thanks for listening, everyone.
Thank you.
Is there a way of getting this to Julie to then send it out to all of us?
That would be great.
Yeah. I will do that.
Well, yeah, you have Julie's contact information, right? Julie Fisher?
Correct, I do.
Okay, if you could get this information maybe to her and she could send it to all of us, and then we have your email addresses, and that would be fantastic. Would that work, Ray?
Yes, absolutely.
Okay.
And just a thing, you might be able to record yourself doing a presentation on this program. And then we could take that recording and then we could show it to Rotary and the other folks instead of having to do everything live, because we know that your time is pretty important. And so it might be easier to just do it, go through it, record it, and then send that too. Does that make sense?
Yeah, I think that's a really good idea.
I'll bet.
What do you think, Larry?
No?
Well, I think you have your program for Rotary when it shows up on your computer.
Well, there you go.
Yeah, I love it.
That's what I was thinking.
Yeah, no, that would be great.
Thank you so much for doing this. We really appreciate it, and our community really needs it. And it is great to have people like you interested in providing this service for our community and evaluating what's going on here and how to get the job done. You've already achieved so much. So thank you.
This is a great little community to live in, especially for young doctors. Did you get my test, girls?
Did we mention we have 2 lakes and multiple rivers?
Yeah.
It's beautiful.
It's less than an hour away. The ocean's only 2 hours away. We can keep going. A lot of good people here too.
You don't have to sell me. I already want to come back here.
Atta girl. I love it. That's what I want to hear.
Well, thank you very much. Do you have anything to update, Jim?
No, put up 3 banners and 1 more and get sent back to redo.
Okay, so
Why don't you let them sign off? So that they can.
yeah, you guys can sign off if you want to. Thank you so much.
Thanks,
Thanks
ladies.
again for having
Thank
us.
you very
All
much.
right, take care.
Bye.
Okay, so Larry, do you have anything else? to
No,
cover?
I've taken more than my time.
Well, any kind of concerns or any opportunities that we're not seeing?
No,
So-
I'm really thankful for these girls and the program. It has some real possibilities for our community.
Thank you. Bob,
I'm good.
you're good. Sean, enlighten us.
I'm good.
Oh, you can't be. You can't.
Any questions?
What's going on? You reaching out to folks and how's the job going? And
We're working on it. Still working through things, still working out that plan for the volunteer program. We'll see where that goes. It's got new wrinkles in it that we'll get into, that I can jump to later or now or.
now.
So, so we're looking at where to work the program or where to house the program, who will oversee it at this point. And how that might look, discussing potentially a position somewhere. Yeah, that discussion hasn't really happened yet. It's coming up in the next couple of weeks. So we'll see where that goes. It's right now about where things are at. By the rest of their.
Is there anything we can do to help you?
You back on that.
Okay.
Think about that. A question I considered, so.
I don't know. I don't want to speak out of school, I guess, but to your point that you made in regards to community health, right? And how the need or the acuity of community health need is so much greater right now.
Yes.
And in the midst of that, it seems, as you mentioned, that all of the resources that bolster community health are being diminished and tucked away and, socially distanced. And so I wonder if we aren't missing an opportunity to address community health amidst a crisis such as the one that we are facing. So like with the community health meeting or the fair, right? And I understand there's a lot of people that goes into that, and it's a big ask, and it doesn't encourage necessarily social distancing, but the reduction or the elimination of those types of events in the midst of what we're dealing with seems like we're going in the opposite direction that we would want to be going. And I mean, I have a really small piece in all of this, and I don't mean to, come into your committee meeting and stir the pot or anything, but it's just, maybe it's my own ineptitude around being able to do things in these circumstances with the resources that we have even. But I guess just to put it out there for the committee to think about, is there anything that we could be doing more so for the community and encouraging community health in the midst of what we're dealing with versus kind of just putting everything in the closet, so to speak, until we're given permission to, I guess, go about what normal business would look like. And so I just wonder, is this an opportunity to be doing something other than meeting and kind of just talking about how we're not able to do anything? Are we missing an opportunity?
I think
not to be redundant.
Just
I don't know.
Come back around to that for myself, and I know Dick and I have both been talking a lot about this. If you go back and look at the city council's goals that they had set, one of those is mental health and behavior. Mm-hmm. That's not being addressed in a sense to the degree I think it could be for our community. And if any time, this is the time for that, with people dealing with what they're doing with the COVID, non-social distancing. So it's something Dick and I have kicking around. Can we bring a focus to that, just that piece of that? Because there's about 5 goals, if I remember, on that city council. You look at memory care, senior health services, and mental health are probably the 3 that are not being really focused on as much, because physical therapy was one of the ones. We've got physical therapy in Sweet Home, and urgent care is another one. We do have Samaritan here. So I think it's the other 3 that, if I had to pick, those would be the 3 I'd come back to. But mental health and substance abuse, and those are probably the ones that also have a real carryover to what Sean is trying to deal with that, with the focus on people that are living on the streets. I just talked to my son today. He's up in North Portland buying a home, and he said he went down. He said, "Dad, I've never seen it like this in Portland before." He went down 32nd or something. He said it's motorhome after motorhome after motorhome piled up in an empty lot. And he said this is where people are living. It's people that actually have jobs, but they're living in a motorhome because that is all they can afford, and they've lost their houses. So to me, if I would say, we put collectively an effort, it would be, can Dick and I or someone bring a workshop or something around mental health awareness to Sweet Home? So that's kind of what we have, that we're toying with that idea somewhat.
And you know, to the point that she made, with 38% of the population being senior citizens or moving in that direction, right? And that's the most vulnerable population when we look at COVID, right? And so it's like that community education piece. Is there more that we could be doing in regards to, because it, you know, for me, if I rely on the media to get my information, it's a very unstable source. And so I just wonder, around all of that, is there something virtually that we can do? I mean, and I'd be more than willing to do whatever I can in terms of the substance use disorder and all of that stuff, but is there something that we can do in lieu of the, you know, health fair?
Exactly.
That targets this specific time that we're in, because I think it's a really important, and you know, all of you are very involved and obviously love the community and all of this stuff. So it just seems as if this would be the perfect time to engage the community and talk about social distancing, what the benefit of masks are, what downside, you know, and just general education and resource.
Well, right now is you've got the school systems throughout our country and children that are dealing with this mental anxiety of how do we make this work? And there's got to be a tremendous amount of frustration and anxiety and depression all rolled out in this whole concept. I mean, I see it through my son because he's got 2 small girls and they're trying to figure out, okay, I've got to change my work schedule to accommodate their needs, which throws him out. I thought, like, well, when does he get a day off? Because he's taking Monday and Tuesday to be with the girls to educate. And then the wife, they're separated, so she's trying to switch off. So I'm thinking, just look at that dynamics alone. Yeah. I'd be ready to pull stakes on the.
So from a school point of view, something to talk about here. Now it just hit over 50% of the people want to do distance learning. Over 50%. So that's a movement of like 15% from where it was, and it'll probably move a little bit more before school starts. So they're looking at being able to do some distance, some social distancing, but they're still having that anxiety within the community.
So
Would a Zoom meeting work? Well, probably not, because again, 33% of the people don't even have access to internet. How do you get that across? How do you make that available to everybody? Is it in a form that you go door to door and hand out flyers?
I mean, outreach, right? That would be the only way to get to these people who don't have access to.
You know, I'm
Well,
just.
what we have to deal with is social distancing.
Mhm.
So if we were able, and I apologize, some of the things we were working on kind of died because they couldn't get legs in this COVID environment, but the court is working really well and getting going. So that's a difference. But I think if we think outside the box and come up with something that's viable for the community that we need, and I would think, Dick, if I'm right, we're talking about self-care in COVID, right? Is that what because we have substance abuse, we have emotional trauma, we have family cultures and dynamics and all of this stuff going on, and people aren't protected from that. And so how do we deliver that? Some people can do a Zoom, some can't, but we just need to socially distance them and still use an old floor plan, can't we? As far as, don't they come in for trauma-informed care? Does the county have something in the way of self-care, Dick? Outreach with?
But I think you're addressing the fact that, well, the obvious that everyone's having, they don't know how to get those kinds of informative discussions in front of people. I did want to interject a little bit. I'm not even sure what the concept is for out of the box, but basically I want to remind people that from an elderly perspective, folks are sitting at home, they're all by themselves, nobody's paying attention to them. When we were doing things at I'm also on the Mental Health Advisory Board, we used access through Meals on Wheels, and not dissimilar for the idea of getting information to people through the meal sites. You can actually use Meals on Wheels and work with those people as a training kind of possibility. And I also thought the same thing when it comes to folks to be able to sit down and actually eat at the church when they're doing man meals. You can actually have folks join and talk these things. Find someone who knows what they're doing. It's a difficult group to talk to, but they generally are receptive. You just have to be careful about it. So there are ways to do it. We're just going to have to put some heads together and think about it.
Well, and Millie does the meals, school meals, so we could maybe do something there also. But I remember an old Western movie, and it said nobody wants to be called low down and high smelling, and I'm where I'm going with this is that nobody, if you went and said, you need to go to a mental health meeting, nobody wants to hear that. They have to accept that on their own.
But they go to a self-care meeting.
That, what I'm saying, and I mean, I'm using that other analogy that nobody wants to hear that. They may need to hear it, but nobody wants to hear that. But somehow they have to come to the conclusion that they do need to be there.
Very, very quickly, Jim, and I'll just use the elderly example. What we discovered is you go to people's homes, again, skip the COVID issue, you go to people's homes and you talk to them, the elderly folks, you talk to them about that old person who's living next door to them. And it's really important that they have friends. And it would be nice to have someone who paid attention to them. I was very careful about making sure they got up in the morning, that sort of stuff. Now, as soon as you take it away from the individual and you move it to the next door neighbor, it suddenly all changes. And they buy into it hook, line, and sinker. Of course, 12 minutes later, you're over next door going, now about that next door neighbor, I mean, you can do this. You can do this. The kids are the same way. You don't imply that there's anything wrong with them. You give them the strength. You acknowledge that they have strengths within them, and learn how to share with the person next to you. And you just build on that. It's time. It takes effort, but you just kind of have to zero in and do it.
So recently, Jim had a retiree group. And our friend came in and they signed up, they socially distanced and learned how to do Zoom meetings. And so they could go back and help their friends and follow up with practice Zoom meetings, because you don't have to have a formal meeting. You can just be a bunch of people sitting around talking and having a good time. And so they just set regular times to do this, or family. Yeah, that's a great way to engage with your children. You just don't, if you've never done a Zoom meeting, what does that look like? What things do you click on, and how do you do that? And we absolutely have the ability to provide that kind of knowledge. It's a little baby step.
Yep.
So is that a start? And then possibly, since we have an expert in the room about Meals on Wheels, are they still performing? Are they still providing those? Dick, or are they grab and go?
I don't know. That's not my. I use them selfishly. I don't know.
Because I know a lot of the meals that are being prepared and given out are grab and goes. So
my understanding was, at least in the Albany area, they were delivering, but they were putting them on doorsteps and leaving, so that the people still got food, but you didn't have any face-to-face interaction. That was a while ago. I just stopped at a stoplight this morning behind a Meals on Wheels van, and they're in town, so they must be doing something.
This is Ray. I believe they're doing the same thing here.
Yeah.
It's a drop off versus that face to face.
Well, I think one of the things too, Dick, I think to build on what you were saying, when it comes to mental health, I watched a program this morning with children. And even though they're dealing with the anxiety, it's the way they proposed the questions to these children. It was basically, how are you feeling about this COVID in school? It was an open-ended question. And those kids just poured their hearts out. How do you feel about mom and dad teaching you at home? I don't like it because they don't know anything. I mean, these kids were very honest with their feelings, but you know, when you talk about the mental health, don't use the word mental, just pose the question. And you know, it's no different what you're talking about. How are you feeling having to stay at home all the time? It sucks, you know, I don't like it. This is how I feel. That flushes all that stuff out. So then you can kind of come along with, there's some resources out there available to you. Don't know if you know them or not. I think that's the way you approach the whole mental health, especially during this crisis.
Is there anything that we could act upon to give our conversation legs?
Well, I think some of the things like you talking about thinking out of the box. When you talk about social distancing, I'm keen with some different groups, but I think if we hit on a topic like you're talking about, dealing with anxiety and that, social distancing, if you had some sort of a, Oregon Humanities is one that always catches my eye and ear a lot. I love that group, is they usually have a guest speaker comes in, they facilitate a meeting to your topic or what they have in place, but they only require like 20 or 25 people. It's just, we're having this communication program, would you like to come? And this is what we're going to be talking about. And then people just come. And I think that's maybe a good approach. Social distancing, if you're talking, excuse me, small groups of 25 or 20, you could do it over a course of so many quarters in a year and cover a lot of ground. Because once you get it out to this person, they're probably going to go talk to that person that didn't go. And then it kind of catches on.
And an ad in the paper once it's done in the story. So do you think that they might be interested in doing something at the park and everybody bring their lounge chairs and spread them out?
Yeah, I mean, it's just something I think
This
that
time of year, we
sort
could do
of
it there.
process can be done, you know.
Even a month from now, we can still do it.
It's finding the right guest speakers. I know that's one of the things I talked about with Dick. Could we find a guest speaker that has the knowledge and the ability to do that and make it feel very relaxed atmosphere to let people just talk, just a roundtable discussion. And I think that's how you impact the community as a whole. I mean, Samaritan Bus, Dick and I have struggled so much. I mean, I pounded the pavement so much that I'm ready to beat my head on the wall because it's there. People don't show up and they're like, okay, what do I need to do to wipe the word free on the side of this? And maybe that could be some of the stigma, because when they see a bus sitting there, they're probably thinking, I'm on a limited income. What's this going to cost me? Do I have insurance? So I think that is probably one of the gates that people don't want to step through, you know, even though it's available to them. Man, I've got so much money, I can't afford to go on that bus, you know. So, I mean, that's some of the hurdles we have continued. But I think a free open workshop like that, and even Oregon Humanities, it's such a small fee. I mean, I think it's less than $100 if you get them here. They come out of Portland and they have professionals that do this. And I'm sure in Dick's field and mental health, there's people out there that would come, I think. I hope I'm not speaking out of turn, Dick, but I think there's individuals out there in the health services business that would, even the Samaritans of the world, if you ask.
Well, you know, we had Di do the leadership kids, and she did a good job.
She's awesome.
I mean, there's different people that are even local here that would do a good job of conveying a message. We just have to have somebody that their name might draw.
Well, but if we were each assigned to give 5 people, we could do it. You know what I mean?
I've got an email I just sent back, and Dick knows the person is Brandy O'Bannon, who works for Samaritan. They're the executive director, and I think you also put
Know
her,
her pretty well.
sicked her on to me. But they're with the Samaritan Hospital Foundation, so I just floated that idea to her today, and I haven't heard back yet, say, you know, by the way. So I kind of reaching out, seeing if there's some resources out there, because if Samaritan or any of these, I mean, you got medical students and others in the profession that may be willing to step up and do
So
something.
I actually have a family that is the lecture on
Should
medical.
It should go.
Yeah, no, I'm saying that Rick's
Tom.
brother,
Yeah, but they're not
that's what he
local.
does for a living. But, you know, there's some folks that we could probably get here from time to time. But I think, you know, Corvallis Clinic, a few of them, my friends from there, I could probably get one of them to come over and talk if we wanted. You know, there's people that could do this, that could talk about our community, because they see people from our community.
So,
And I know earlier, Lisa, you talked about trauma trainings. Rhonda Green, who was with the health fair, she does it for free. And I'm thinking there's a resource right there. If you needed that sort of training and education, the person's there.
so as far as mental health first aid or trauma informed care, I mean, we need to look
I think
at
she
this
does
and say,
both.
okay, what are we doing?
Doesn't
And
she? Doesn't Rhonda Green do both of those? Dick?
I don't, well, I'm not sure, but I think it's just the one. I think it's just trauma informed.
It's the trauma
Okay.
care.
And yeah, and those are all limited too because of the COVID thing.
Yeah.
But
I
you
mean,
know,
there are resources.
having some, there's a lot of goals and things within that could be taught or looked at during a session, whether it's a complete thing or not. You could still talk about some of the goals of trauma-informed care or the reasons for that.
You have to be a little careful about that because there's copyright issues and all that. This is a formal
I'm not
international
saying I have to do
program.
that. I'm saying that, you know, like Rhonda Green, if she was here to do that, could talk about some of the goals within that program, even if she's not teaching the full program.
Right.
are you interested in taking this project on? Good.
Yeah, I mean, Dick and I have kind of worked on, we can put I've already got some feelers out there for that. I think between Dick and myself, I'm thinking for you, Dick, here a little bit, I think we could come back at the next meeting and say, here's what we found. Here's what we might be able to pull off. And if the groups gives it the blessing, then I'd say we move forward with it.
Yeah.
I mean, that's just my take on it. And like I said, that aligns with the city council's goals. If we're looking at some sort of mental health or behavior, it aligns, and I think it's doable. It forces me to get off my backside and
That's a good thing.
watch it, Dick.
So we're looking at a topic, a location, a date, PR, what's this gonna look like? And all set up because our speaker needs to know in plenty of time.
Well, if the speaker can tell
The
us
first
what
one.
they
And,
want, then there's how you can.
and if it's successful, we move forward. I think though, that we could just hone it and find another.
We could do the first one outside. I mean,
Yeah, why not? Maybe even the
There's
first
no
two.
reason to not.
So we're still doing the Harvest Festival.
It's outside.
It's gonna be outside and we're finding workarounds. So for instance, each group, you're held to a certain number of gatherings. And that number is changing depending on which phase you're in and how the government wants to define it that day. So, I mean, we're finding ways to work around. So for instance, there's just gonna be several different functions going on in the park.
Different venues.
Yep, and each function is going to have a permit separate from each other. And they're gonna be, if we need to, depending on turnout, they're gonna be separated. So there's ways to make it happen. You've just gotta be creative.
Yep.
And you gotta kind of be willing to, wink, wink, nod, nod, and maybe cross your fingers a little bit, I guess, but,
I see as social distance events possible.
absolutely. And you know what? People are tired of it. And, you need these. I mean, I just took 11 kids to Boise, Idaho to play basketball. You got the wrestling program taking kids to Utah to wrestle. And it's amazing. It's twice as amazing now as it would have been if we weren't in this, which is great. But there's ways to do it. We can make those things work out. So.
Good discussion.
The council school board, do you think that's something we could do a Zoom meeting? We're already doing a Zoom meeting to get these.
Yeah. We can so we use Microsoft Teams, but we can, I don't know, are you guys more, is your board more tech savvy than the council? Because there's a couple that might struggle with the new platform. We're just getting them in on the Teams.
I don't know, we do Zoom meeting every month.
Well, if the girls are really going to create a presentation, you could each do them individually.
Oh yeah, if they're going to record it.
Yeah, and that's what it sounded like you asked them to do, and they seemed like they might be up to that. Then you could each just present it at your respective meetings as a program.
Yeah, we can do that.
Either or, I'm sure we can figure it out.
Larry can come and present to the city council.
Essentially, we've got six of the counselors are coming in person anyways. So we could set the Zoom just in this room. Because we're spacing people out. We're getting 6 or, well, actually lately 7 counselors. Everyone's showing up and just wearing their mask and face shield, spreading out. And then, so we can figure out.
Yeah, we have a few more people in the school board, so it's a little harder
Right.
to space them out.
Number 9.
Yeah,
Yeah.
9 board members and the
But you have,
superintendent and the this and the that.
you have access to gymnasiums though, so.
Well, but it's a lot easier to just do it on the call.
Yeah.
Right.
So we could handle the technology, get all 7 of them here for the most part. And if not, the one person who might not be here is fairly tech savvy and can figure it out. We can make it work.
Well, we'll figure out if they're gonna.
Yeah, let's see what they come up with.
Yeah. I just want to make sure that we get that done and we don't forget about it.
Okay. So at this point, are you entertain a motion to adjourn?
So
Do we have a second? All in favor?
Aye.
Any opposed?
Aye.
Motion passes. Now you have all.
Bye, and all that.
Dick, you know that television,